Diabetes mellitus is a chronic condition that affects millions of people in the United States, United Kingdom, Canada, and Australia, damaging overall health and leading to serious complications like cardiovascular disease, kidney disease, dementia, and stroke treatment needs. Many people ignore the early signs of diabetes, allowing high blood sugar levels to silently destroy the body before diagnosis. Recognizing these warning signs early can prevent long-term complications and help individuals manage diabetes effectively with the right insulin, blood sugar supplements, and a proper diabetes meal plan that follows the American Diabetes Association diet. One of the first and most common signs of diabetes is frequent urination, also known as polyuria. High glucose levels force the kidneys to work overtime to remove excess sugar from the blood, leading to increased urination, especially at night. Many people assume frequent urination is caused by drinking too much water, but if it is accompanied by excessive thirst, it could indicate dangerously high blood sugar levels. Over time, this excess strain on the kidneys can contribute to chronic kidney disease treatments and, in severe cases, lead to kidney failure requiring kidney dialysis. A simple sugar test can help determine if frequent urination is due to diabetes or another underlying condition. Excessive thirst, polydipsia, often goes hand in hand with frequent urination. As the body tries to remove excess glucose, it pulls water from tissues, causing dehydration and an unquenchable thirst. Many individuals with undiagnosed type 1 diabetes or type 2 diabetes treatment needs drink large amounts of water but still feel thirsty no matter how much they consume. This cycle of dehydration and urination can place added stress on the heart and stroke system, increasing the risk of heart failure and heart arrhythmia. If extreme thirst is persistent, it is essential to monitor blood sugar levels with devices like the Dexcom G7, or consult a doctor for a sugar test to confirm a diabetes diagnosis. Unexplained weight loss is another major warning sign of diabetes, particularly for those with type 1 diabetes. When the body lacks enough insulin to use glucose for energy, it begins breaking down muscle and fat, leading to rapid weight loss. Many people dismiss sudden weight changes as stress-related or due to changes in diet, but when combined with high blood sugar levels, it can indicate diabetes. Individuals experiencing unexpected weight loss should speak with a doctor about possible type 1 diabetes or type 2 diabetes treatment options, including Tresiba insulin, Lantus insulin, or an insulin pump to stabilize glucose levels. Constant fatigue and weakness are major symptoms of diabetes that occur when cells are unable to properly absorb glucose for energy. Despite eating regularly, individuals with high blood sugar levels may feel exhausted throughout the day, as their body struggles to use nutrients effectively. This fatigue is often mistaken for poor sleep, but it may actually be a sign of chronic insulin resistance, which increases the risk of cardiovascular disease, kidney disease, and stroke treatment needs. For those experiencing persistent fatigue, monitoring blood sugar levels with the Dexcom G7 and following a structured diabetes meal plan can help restore energy and improve overall health. Blurry vision or sudden changes in eyesight can also be an early indicator of diabetes. High blood sugar levels cause fluid imbalances in the eyes, leading to swelling of the lenses and difficulty focusing. Over time, uncontrolled glucose levels can damage the blood vessels in the eyes, increasing the risk of diabetic retinopathy, a leading cause of blindness. Many people assume vision changes are simply due to aging, but those at risk for diabetes should undergo regular eye exams and monitor their blood sugar levels closely. Proper management with Lantus insulin, Tresiba insulin, or an insulin pump can help protect vision and prevent long-term complications. Tingling, numbness, or pain in the hands and feet, also known as diabetic neuropathy, occurs when prolonged high blood sugar levels damage nerves. This symptom is common in people with chronic kidney disease, as poorly managed diabetes affects circulation and kidney function. If nerve damage worsens, it can lead to serious complications, including infections and amputations. Individuals experiencing numbness or tingling should work with a doctor to stabilize glucose levels through blood sugar supplements, diabetes meal plans, and medications that improve insulin sensitivity. Slow-healing wounds and frequent infections are another major sign of diabetes, as high blood sugar levels weaken the immune system and reduce the body's ability to repair itself. Small cuts, scrapes, or sores, particularly on the feet, may take weeks or even months to heal, increasing the risk of serious infections. Many people with diabetes also experience recurring bacterial or fungal infections due to a compromised immune response. If wounds are healing slowly, it is essential to consult a doctor for diabetes management options and possible kidney disease treatment, as poor circulation and high glucose levels contribute to long-term health complications. Increased hunger, despite eating normal or large amounts of food, can be a sign of diabetes due to the body's inability to properly use glucose. When insulin is not functioning properly, cells remain starved for energy, causing constant hunger cravings. Many individuals struggling with high blood sugar may find themselves eating frequently, but still feeling unsatisfied. This excessive hunger, known as polyphagia, can contribute to obesity, heart failure, and cardiovascular disease if left unmanaged. Implementing a diabetes meal plan following the American Diabetes Association diet and using insulin pumps or blood sugar supplements can help regulate hunger and stabilize energy levels. Dry, itchy skin and dark patches around the neck, armpits, or groin, a condition known as acanthosis nigricans, can indicate insulin resistance and undiagnosed diabetes. This occurs when excess glucose damages skin cells and reduces moisture levels, leading to dryness and irritation. Dark patches of skin develop due to high insulin levels, signaling an increased risk of type 2 diabetes treatment needs. Many individuals mistake skin changes for common rashes or aging, but if accompanied by other diabetes symptoms, it is important to monitor blood sugar levels and seek medical advice. Cognitive issues and memory loss, including confusion and difficulty concentrating, can be linked to diabetes, as high blood sugar damages brain function over time. Studies show that people with diabetes are at a higher risk of developing dementia, as prolonged glucose imbalances contribute to cognitive decline. Poor blood sugar control also increases the risk of stroke treatment needs and heart and stroke complications, further worsening brain function. Managing diabetes through Lantus insulin, Tresiba insulin, insulin pumps, and a structured diabetes meal plan can help protect brain health and reduce the risk of dementia care needs later in life. Recognizing the warning signs of diabetes early is essential for preventing severe complications like chronic kidney disease treatments, kidney dialysis, heart failure, and dementia. Monitoring blood sugar levels with tools like the Dexcom G7, following a balanced diabetes meal plan, and using insulin therapies such as Lantus insulin or Tresiba insulin can help maintain health and prevent long-term damage. Taking action now can improve quality of life and reduce the risk of life-threatening diabetes complications.